Pedagogy University and everyone. I would like to say that it's our honor to be presenting for the 9th undergraduate research competition. My name is Yamama Namer, and he is my colleague Omar Jihad. Today we will be talking about our literature review on the comparison of the safety and efficacy of anti-angiogenic drugs, chemotherapy, and immunotherapy in treating deadly cancer types. Basically, we've divided our presentation into 4 parts. We start with the introduction, followed by the methodology. Then we will discuss our results, ending up with the conclusion and future directions. To start up, cancer holds the responsibility of 25% of mortality worldwide, being among the top 10 life-threatening diseases. The traditional kind of therapy used for cancer includes surgery, radiotherapy, and chemotherapy, which are passive and only treat symptoms. And given the fact that tumor cells are specific, it is important to develop targeted therapy like immunotherapy and anti-angiogenic drugs. For angiogenesis, which is the induction of new blood vessels to help cancer cells survive, it is regulated by many factors like the vascular endothelial growth factor and also by a receptor of this type of growth factor. And we also have the hypoxia inducible growth factor, the fibroblast growth factor, and the platelet-derived growth factor. So by inhibiting these factors, we'll end up having the anti-angiogenic drugs that can eradicate tumors. For the second type of therapy, we have the immunotherapy that have evolved from the immune surveillance hypothesis, saying that the tumor cells get recognized by the host immune cells and the host immune system and killed by it. We have a lot of agents like the cytotoxin, cytotoxic T lymphocyte-associated antigens, immune checkpoint inhibitors targeting PD-1 and PD-1 ligand. So it is important to outline the safety and efficacy of all these treatments in treating different types of cancer, especially the deadly ones, and to make sure that each patient's need is met. So therefore, we aim to review existing literature on this topic to make sure that the therapeutic outcomes are being met. We did so by searching to specific databases like PubMed, Google Scholar, EBSCOhost, and Wiley Plus, ending up having 300 to 400 articles. So we narrowed our search to include articles that are written in English and published in healthcare journals, and those that are research-based articles, ending up selecting 70 articles. To start up with the first theme, that is comparison of the efficacy in treating lung cancer. Lung cancer is one, if not the most dangerous type of cancer, being responsible for 24% as a cause of cancer-related death worldwide, especially the non-squamous cell lung cancer. For the anti-angiogenic agents, given the fact that the proliferation of tumor cells is malignant, anti-angiogenic drugs will only provide short-term efficacy. While on the other hand, the chemotherapy, 2 approaches have been studied. The first one involved a triple combination, which showed positive outcomes but adverse effects at the same time, while the second one targeted the RNA polymerase II, which by activating it will have an acceleration of the tumor transcription. So an inhibitor has been developed, which is the lobrigidine, and it showed positive outcomes and adverse effects at the same time, but got the FDA, but the FDA has granted it an orphan drug status. For the immunotherapy, a lot of agents has been studied. And they include the impilimumab, which showed positive and adverse effects at the same time, and pembrolizumab, showing an overall survival of 70.3 and 60.4 in 2 studies. Other agents showing positive outcomes include the nivolumab and the atezolizumab. For the second type of cancer, we have the pancreatic cancer being the 4th deadliest type of cancer. For the anti-angiogenic agents, sunitinib and pazopanib has shown positive outcomes, especially the pazopanib, as it shows an overall response rate of 18.9, and a disease control rate of 75.7%, and a median progression-free survival of 9.81 months. On the other hand, for chemotherapy, gemcitabine has been regarded as the backbone of the therapy as it resulted in more response in comparison to fluorouracil, and when combined to other cytotoxic agents and targeted therapy like sunitinib, it resulted in adverse effects. So it was combined with Taxol, that is a microtubule inhibitor, showing a response of 35% in the combination group in comparison to 22% in the monotherapy group. However, it was associated with neuropathy and myelosuppression. Finally, in terms of immunotherapy, 5 approaches can be applied here, like the monoclonal antibody, adaptive T-cell transfer, the vaccine immune checkpoint inhibitors, and the use of interleukins like interleukin-10 and interleukin-7 beta. However, they did not show efficacy in treating this type of cancer. Now my colleague Omar will continue talking about another disease.
Hello, my name is Omar Katan, and I will be now continuing from my colleague Yamama, continuing on our final theme, glioblastoma. Perhaps it is of the most deadliest cancers in the world, as to its complex treatment and complex physiology of the brain itself that hinders many approaches of the treatment for this type of disease. Starting with the anti-angiogenic agent, it is nowadays that bevacizumab, which is an anti-angiogenic agent, is the gold standard of the treatment of this type of disease. Our primary endpoints in all the researches we reviewed was progression-free survival and overall survival. Bevacizumab, in terms of anti-angiogenic agents, has presented many success in the clinical trials and high progression-free survival rates and overall survivals, and in addition to good improvement. In terms of chemotherapeutic agents, many clinical trials have been reviewing clinical cytotoxic agents, and specifically we included the Japan Clinical Oncology Group that stated that cytotoxic agents has a problem, which is not having the ability to overcome the blood-brain barrier, which causes a problem, and also many side effects and toxicity cases. Lastly, in terms of immunotherapeutic approach, Checkmate clinical trials have reviewed the immunocheckpoint inhibitors like the anti-programmatic death antigen, and also the cytotoxic T lymphocyte antigen 4, and they presented toxicity in monotherapeutics, like administering the drug alone. The toxicity grades were 1 and 2, which means it's mild. And in combination, it presented more severe toxicity cases with grade 3 and 4. Another Checkmate clinical trial have reviewed these immunotherapeutic agents, and it did not reach the primary endpoints, which led to a termination of the clinical trial. And lastly, in this approach, the vaccine therapy has been reviewed, which targeted the EGFR. The obstacle that the researchers had was not all the glioblastoma cells are expressing that receptor, therefore it cannot be eradicated fully, and the clinical trial was terminated. Finally, in our presentation, we will review the comparison and safety of and toxicity of the drugs. We have many toxicity cases in these drugs, but we reviewed some of them, like cardiovascular toxicity, bone marrow depression, hepatotoxicity, and pulmonary toxicity. Angiogenic agents did not present much of toxicity cases in all of these types of toxicities. Chemotherapeutic has presented some of them are severe, some of them are rare and likely to happen, and only common in the cardiovascular toxicity. Lastly, the immunotherapeutic agents have reported also relatively rare toxicity cases in terms of pulmonary toxicity, cardiovascular toxicity, and also hepatotoxicity, in addition to bone marrow toxicity. But whenever they happen, the toxicity cases, it will be severe or fatal. Finally, to conclude our presentation, cancer presents a very serious worldwide disease, which is in most cases fatal, which urge us to develop and research new agents and to develop our current approaches to treat these types of cancer. Safety and efficacy of anti-angiogenic agents, immunotherapeutic agents, chemotherapeutic agents, which we reviewed in this article, should be assessed and should be researched more to treat these deadly types of cancer. But however, we need to emphasize more on major points that has to be done in the near years to come. First of all, to research more on the nanotechnology that can be applied with anti-angiogenic agents, as it increases their bioavailability, and thus we enhance the spectrum of activity. Then we have to also review the safety profile of the immunotherapeutic agents and other approaches other than hematological ones in context of COVID-19 pandemic. And finally, we need to review the hepatotoxicity of anti-angiogenic agents on real humans rather than the animals that we have, to have more realistic outcomes. That's the end of our presentation. Thank you for listening, and goodbye.
Thank you.